Welcome inside the 13 ABC Marketplace. My name is Eric Halbert. There's been a lot of debate and discussion over the COVID-19 vaccination for adults. But what about for kids? For that answer, you need a pediatrician, and we have one inside today's 13 ABC Marketplace.
My name is R.W. Mills. I'm a pediatrician here in Northwest Ohio. I've been practicing for 35 years, and I'm the senior pediatrician for Pediatricare Associates. Early on in my career, I found pretty quickly that immunizations probably are the single most beneficial thing for pediatric patients. And I'm old enough now to have seen some of the diseases that we used to have that we no longer have. So when I teach medical students and residents about certain diseases, many of them never even heard of some of these diseases. And we started doing these vaccines, and so as somebody who's lived through this process, I've seen the benefit of vaccines. I've seen whooping cough go down tremendously. I've seen Haemophilus influenza, which was a devastating disease that not only caused swelling of the airway, but also caused devastating meningitis. Then we developed, while I was in training, literally as a resident, Haemophilus influenza B vaccine. And we started giving that as routine, just like we did the pertussis vaccine. And that's improved over the years in terms of the quality of that vaccine, and the side effects that we used to have are not nearly what we used to with that vaccine. And so what I saw was a transformation of these babies that used to die from these diseases. We don't see that anymore. It's nice for me to teach residents about these diseases that they've never even seen or heard of, because the vaccines have literally transformed the way we practice medicine. So tremendous benefit in terms of the single most important thing in the advancement of the care of our children, no question in my mind, over the last century is the vaccines and the improvements that we've made with the vaccines. Along comes this crazy COVID-19 that is brand new to all of us, obviously. And then the challenge for something that's a global pandemic that has been devastating in terms of the health and well-being of not only adults but pediatric patients as well. And development of this COVID-19 vaccine, which occurred at a faster pace than we've ever seen. Typically for pediatric patients, these vaccines get developed over a period of about 8 to 12 years. So it can't be overstated just how incredible the development of this vaccine was and how quickly we were able to come about this. Now currently the two vaccines that we have available for our adult population, and 16 and above, if you include the messenger RNA vaccine from Pfizer, those two vaccines we aren't currently using in children, but we are starting to test in children. The current testing involves kids 12 and above, and the next round of testing will involve kids 6 to 12. Younger than 6 we haven't talked about yet, but it's going to take a lot of time for that younger group to be tested. We want to make sure that for the youngest children that actually are doing much, much better than adults, that the vaccines that we're doing for those younger children are very, very heavily scrutinized and researched in great depth for obvious reasons. Since kids do better with the COVID in general than adults do, we want to make sure that when we do anything to alter their immune response, that it's the right thing to do. Clearly, what we're seeing from the adults and the current studies for the messenger RNA vaccines are very, very promising.
Inside the 13 ABC Marketplace, I'm Eric Halbert.